Once you have the myTAP in place and you're wondering how you adjust it to make sure your airway's open at nighttime, the best thing to do is to put it in your mouth and then take your fingers on that little knob up front. So you put it in your mouth, you take your fingers on the knob and you turn that knob towards your left shoulder. So you're spinning it while it's in your mouth. And you turn it towards your left shoulder. That'll make your lower jaw come forward. And find the place where it's a little uncomfortable. So it's about as far forward as you want to go, because otherwise it would be painful, maybe even a little bit uncomfortable right there. And then you back it down a little bit. So you find kind of the limit and you back it down a few turns to make sure it's going to be comfortable enough for you. And that way you'll start at a place where you can keep using it. Very important that way. And you can back it down a little further if you want. It's okay as you get used to wearing it, but that's how you make your jaw come forward. And if you're waking up in the morning and you feel like you haven't breathed well through the nighttime, you want to bring your jaw further forward. You could be snoring. You could be waking up feeling not rested. You could be having somebody tell you that you're not breathing well. Whatever feedback you can use to make sure you're okay. And you would get to adjust your lower jaw forward and back to make sure you're comfortable enough, but yet it's also going to be okay for getting your airway forward. It might take you a few days to work up to that. That's okay.